is Shreya, fertility specialist from the Baby Cradle Hospital, Edapally. Today, we are going to talk about a topic that is very dear to my heart. We are going to speak about menstrual cups, a sustainable way to manage your period. What is a menstrual cup? A menstrual cup is made out of medical grade silicone and it is a way to sustainably manage your menstrual cycle. As you can see, this is made of medical grade silicone. It is FDA approved. It is an inert substance, and the best part about this is a single cup can be used from 5 to 10 years if it is maintained properly. How can a single cup be used for 10 years? What we do when we get this cup is that we have to sterilize this in boiling water for 10 minutes, and then we can store it in sustainable packaging that comes usually with the menstrual cup itself. Before every cycle, you just need to wash it with warm water or water and soap, and then when your period begins, please remember that you can use this only once you're on your period. If you try to use this as a trial before your cycle, it can cause a bit of irritation because the vaginal mucosa and everything is very dry and not pliable at the time. So once your period starts, you can try using this. Let me warn you that you might not get this right in the first few trials. This is a very important thing to understand because it has a learning curve. To use the menstrual cup, you need to have a little bit of experience. First few times you might have some leaks and you might be very apprehensive to use it. People of all age groups can use the menstrual cup. The only difference is that you get it in different sizes. Most brands nowadays, they come in small, extra small, medium and large size. How do you choose what size of menstrual cup you use? In teenage girls who have just attained their menarche, they might usually start with just a sanitary napkin to begin with, but they also can use the menstrual cup. They usually would require a size XS. So the difference in size is that the circumference of the rim of the menstrual cup would be much smaller, and so would the capacity, but they also bleed only that much. For people who are sexually active or for people who are more than 21 years old, you can use the size small because they have not yet undergone a vaginal delivery and they wouldn't require a bigger size. For people who have had multiple deliveries, they might require a size M or a large size. I'm going to show you a demo of how to use a menstrual cup. I'm going to use this bottle to show you how to use the menstrual cup. The first thing you need to know is that since this is a pliable material, you all must be wondering how this gets into the vagina. What we do is, there are different types of folds that we need to know. I'm going to explain some folds to you. There are different kinds of folds. I'm only going to explain the easiest ones. This is the C fold method or the U fold method. If you can see, this is like a C or a U. Okay, that is one method. Then there is the push down method. Take one side and you push it down. With this method, what happens is that the circumference is reduced highly, and once it enters the vagina, you can use this portion to help it open up. There are other few ways to fold which are kind of complicated to try. This is the diamond method, and then you can make it smaller. This is for people who have tried all other methods and have failed. This is the diamond method, and there's the E fold method, which tries to make it even smaller. These are a few of the common folding methods that are there. Consider this as the mouth of the vagina, and this is the menstrual cup in itself. There are different folds that you need to know while trying to use the menstrual cup. I'm just going to demonstrate the C fold and the push down method, which are the easiest ones that I have come across. This is the C or the U fold method, but since the circumference is still larger on this one, I prefer to use the push down method, that is this. The circumference becomes very small with this. What you got to do is, considering this as the vaginal opening, this as the posterior portion, this as the anterior portion, the folded portion of the menstrual cup goes in first and Using one finger, you push it up into your vaginal canal. You might feel apprehensive, you might feel funny, but once it goes in, you will feel a give way sensation and you can just pull it down and you'll feel that it is tightly fitting the vaginal canal. And this will collect all the blood. It doesn't have any space to glide up and get lost in your body, so don't worry about that. And once after 8 hours or after 12 hours, depending on your flow, you have to remove it. During that, you pinch the bottom of the menstrual cup. It will release the suction and you can just take it out. You empty it and you wash it and reinsert if you're done with your period. Boil it and store it in the sustainable packaging. The benefit of using a menstrual cup is that a single cup can be used for 5 to 10 years. Every period, every month, just a single cup for 5 to 10 years. We are reducing the pollution and the burden of plastic waste by a huge amount if each and every one of us can try together. Another benefit of using a menstrual cup is that it helps maintain the vaginal pH. When you use a sanitary napkin, it is a highly absorbable substance, so the pH of the vagina changes and the normal bacterial flora cannot survive. This causes itching or higher chance of infection and irritation. When we use a menstrual cup, it is just collecting the blood that is coming out of your uterus and there is no other change that is there into your commensal that is there. Another benefit of using the menstrual cup is that you can measure the amount of blood that you bleed in every cycle. If you can see closely, every menstrual cup has markings on it. There are numbers that tell how much of blood is collected inside the menstrual cup. This way, you can quantify whether you are having excessive bleeding or whether you are bleeding too less for your cycles. Some people who should not use the menstrual cup are people who have an active infection and people who suffer from deep-seated endometriosis, who already have a diagnosis of endometriosis, because this might cause some discomfort and pain. People with endometriosis usually have difficulty in defecating or using products that need to be inserted. The difference between a tampon and a menstrual cup is that tampon is in a similar way you insert it into your vaginal canal, but that too is an absorbable substance and it increases in size and causes a high risk of causing toxic shock syndrome. Menstrual cups do not pose that risk. I would highly suggest all youngsters and people who are ready to try to change into this sustainable way of managing your period, and you can reach out to us at any time. The Baby Cradle Hospital, Edapally. I'm Dr. Shreya and I'll be there to help you at any time of the day.